Hello, my name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to take a few moments to speak with you about the management of localized prostate cancer. You probably have just received a diagnosis of prostate cancer. You probably had an elevated PSA blood test, an abnormal digital rectal examination, or both. You then probably proceeded to an ultrasound and prostate biopsy, and the report came back prostate cancer. In this video, I will review the grading and staging of prostate cancer, the further testing that is needed to make sure that the disease is confined to the prostate, and what treatment options are available for localized prostate cancer. Let's look at the grading. Prostate cancer is graded from 1 to 10. The higher the score, the more aggressive the tumor. If it is less than 5 or 6, it is not very aggressive, whereas tumors that are graded greater than 7 are considered by comparison more aggressive. If it is localized, that means the tumor is entirely within the prostate gland and can be cured with various treatment options. Locally advanced prostate cancer spreads to the surrounding tissues right in close proximity to the prostate. In metastatic prostate cancer, the prostate cancer has spread at a distance from the prostate gland, probably to more distant organs such as bones and lymph nodes and other soft tissue organs. So what additional tests are needed to ensure that the tumor is confined to the prostate gland? If you have a significantly elevated PSA, your doctor will probably order a bone scan. This is an X-ray of the entire body that highlights areas where the cancer might spread, such as to the bones, particularly the bones in the pelvis or in the lower spine. An ultrasound exam looks for effects of urinary blockage to the kidneys. A CT scan, or computed tomography scan, is the best way of determining the extent of the cancer as well as distant metastases, and can identify enlarged lymph nodes. A cystoscopy is the insertion of a thin, flexible tube equipped with a light and a tiny camera on the end, which is inserted through the urethra in the penis to look at the interior of the prostate and the bladder. This test shows whether the cancer has spread to the urethra or to the bladder. Let's now look at the staging system for prostate cancer. The staging system is a method of classifying tumors by their size, location, and extent of spread. The use of the staging system is a good indicator for the prognosis of prostate cancer. The cancer is assigned one of 4 stages based on how far it has spread from the prostate gland. The 4 stages of prostate cancer are stage 1, where the tumor is confined to the prostate; stage 2, where the tumor is large and can be felt on the digital rectal exam, but the cancer continues to remain confined to the prostate; stage 3, the cancer has invaded other tissues in close proximity to the prostate, such as the seminal vesicles or other nearby structures or tissues. Stage 4 prostate cancer is where the cancer has metastasized and is spread to the lymph nodes, bones, or to other organs. By knowing the stage and grade of disease can help to determine how aggressively the disease needs to be treated, and can help and predict the prognosis of the cancer and the treatment. Let's now turn to the treatment for localized prostate cancer. There is no one treatment that fits all prostate cancers. The choice of treatment that you select with the guidance of your physician depends on your age, your general medical condition, your life expectancy, and how fast the cancer is growing. You'll also want to consider the potential side effects of the treatment. One of the treatment options is watchful waiting. If the disease is entirely confined to the prostate, it's low stage and low grade, and the patient is perhaps elderly and the life expectancy is less than 10 years, and the patient agrees to a regular PSA monitoring of his prostate cancer, watchful waiting may be the appropriate treatment option. External radiation therapy uses high-powered X-rays to kill the cancer cells while minimizing harm to the surrounding tissue. It usually consists of 30 to 40 treatments, and there's mild side effects such as frequency of urination and feeling of rectal urgency or feeling of the need to defecate. Most of these patients who have frequency or rectal urgency will find that these symptoms usually disappear shortly after the treatment is completed. Approximately 30 or 40% of men who have external beam therapy develop erectile dysfunction or impotence. Another treatment option for localized prostate cancer is radioactive seed implants or brachytherapy. This consists of inserting very tiny rice-sized seeds of either palladium or iodine into the prostate gland. Usually it requires the insertion of 50 to 100 seeds while the man is under an anesthesia, requiring just one single treatment. The side effects of brachytherapy include the urinary problems of frequency and urgency, erectile dysfunction in 30 to 40%, and rectal symptoms such as loose stools or frequency of having a bowel movement. Looking now to the surgical management of localized prostate cancer is a radical prostatectomy. This consists of the surgical removal of the entire prostate gland. This requires hospitalization from usually 1 to 3 days, and men go home with a catheter for an additional few days. There is excellent survival if the cancer is confined to the prostate gland and has not spread beyond the prostate gland. The complications of radical prostatectomy, including a small incidence of about 3 to 5% of urinary incontinence and erectile dysfunction in 50% of the patients. A newer form of surgery is radical robotic prostatectomy. This consists of the insertion of 5 pencil-sized openings are made in the abdomen with the man under an anesthetic, usually requiring hospitalization for 1 day, and the man has to go home with the catheter for a few additional days. The side effects of a robotic radical prostatectomy are the same as open surgical prostatectomy, which include incontinence and erectile dysfunction. Cryotherapy is the insertion of a probe that results in freezing the area of the cancer in the prostate gland. This is reserved for localized prostate cancer for men who are unable to withstand surgery or radiation. The complications associated with cryotherapy are erectile dysfunction, but usually no patient experiences urinary incontinence. The advantages of cryotherapy is that there is less bleeding and earlier hospital discharge and very short recovery times. A new treatment is also available for localized prostate cancer, instituting the use of high-intensity focused ultrasound, and referred to by the acronym HIFU. This uses the high-intensity frequency ultrasound, which is inserted through the rectum and results in killing of the prostate cancer cells, leaving the prostate gland intact. There is less incontinence and erectile dysfunction with HIFU than with radical surgery. At the present time, HIFU is not approved by the Federal Drug Administration, but it is available in Canada, Europe, the Bahamas, and in Mexico. In summary, prostate cancer is one of the most common cancers in men, and if it is localized to the prostate gland, most men can be cured of their disease. There's no one treatment that is right for everyone. You need to have a thorough discussion with your doctor. If you have any additional questions, I would like to refer you to my website, www.neilbaum.com. Thank you.